serious. Therapists of Reddit, what are some red flags we should look for in therapists? If they immediately try to present you with answers to all of your problems, not lead you to your own solutions, there is a major distinction there. Therapist checks for messages during session. Therapist pushes their own religious views on their client. It's a stupid mistake, but it's common. Therapist discloses content of the sessions to third parties. Exceptions to this rule are consultation, clinical supervision, when a therapist seeks a senior or colleagues for technical advice, or when patient's life is at risk. Therapist flirts with client. Edit for formatting and terminology. I think there is a misconception that advice giving is what is most helpful. Therapists don't often give advice, but rather they offer alternative perspectives and create space for a collaborative approach to explore new ways of overcoming obstacles. We, as therapists, shouldn't ever assume we know what is best for a client to do. It is their life. If you have a therapist telling you what to do, I would have to assume there is an unhealthy power dynamic occurring which can have a variety of negative outcomes. Of course there is a time and place for advice, but usually that should come from a peer or family who are essentially at the same power level as you. Edit. It should be noted that suggestions, recommendations, etc. are totally fair game for a therapist to provide. The difference between this and giving as advice is that giving advice assumes you know what is best and you're telling them to do something specifically. I'll often suggest to my clients, for example, have you ever thought about journaling to get some of your emotions out instead of keeping them in? I'd argue this isn't advice. It's up to them to decide whether they want to do it, and I'm not promising any specific outcome. If they seem to like the suggestion, I may assign homework for them to journal. This is more concrete, like some of you have mentioned, but I don't think it is advice. Maybe it's semantics. Also, every therapist has their own style and personality. It's not always going to be a good fit between client and therapist. Shopping around for a therapist should be encouraged if possible. Find what works best for you. If they start most of their responses with "at least" and then try to put a silver lining on it instead of honoring your pain and what you shared with them. Edit. My use of the word honor in this context is meant to convey that you take a person's hurt and trauma seriously. Don't diminish or downplay what someone went through or how it affected them. Instead, respect what they've been through and how they got through it so you can focus on healing. Edit 2. Thank you to the people that reminded me of Brené Brown's silver lining at talk. It is the perfect example. Much better said, and even illustrated in an awesome YouTube video that helped me put this phenomenon into words. If they are distracted at all, check a text or email or anything during session. If they can get you in immediately, it may mean they don't have many clients. This could either mean they are very new or not a very good therapist. Could also mean they had a cancellation, so do some research. Any kind of flirtation, it does happen. Get out of there. Not helping you define goals to move forward. Some therapists are happy to take your money and just let you itch about life for an hour. And while that might be a relief for you, it's only going to help long term if there are actionable steps taken that are agreed upon by you and your therapist. This is the work of therapy and most important, but also when many people drop out. Edit. Also, I see life coaches popping up on therapy resource pages. They are not trained professionals. Avoid. Second edit. Didn't expect such a response, but I'm glad for the open dialogue. A couple good points have been made. Definitely, being able to get you in right away doesn't always mean something negative. I probably should have left that out altogether. Certain therapists, usually dialectical behavioral therapists, do need to be available 24/7, so certainly they might check phone email, but they should also be upfront with you about that aspect of their practice before you begin. And I'm sure life coaches can be helpful in some areas. My main issue is many are attempting to masquerade as therapists. The amount of hours of their training, 100 is what I read, does not compare to the schooling and the postgraduate hours, 2000, others need to obtain for licensure to treat mental illness. With all of that said, this is a great discussion all around, so thank you to OP for beginning it. If they work in a lot of things about themselves and their lives. Therapist here. My role is a little different as I am a trauma-based short-term crisis therapist, meaning I just help stabilize my clients to where they can be transferred to a lower level of care. To me, warning flags are no risk assessment, no crisis planning, no exploring triggers, no plan to help you cope when faced with a trigger, especially important when triggered and out of session, no timeline for treatment, no discussion about your rights as a patient, too much advice giving. I call this could've, should've, would've people. Also giving advice about anything outside of their scope of practice, medical treatment, religious practices, legal issues, etc. In family couples sessions especially, any therapist who acts like a referee to determine who is right or wrong. Covering these items are important in therapy because it will help the patient long term in processing emotions, using healthy coping skills and problem solving on their own. I can't speak to those clinicians in private practice because I'm in community mental health, but for agency-based therapy, it is not a long-term service. Most CMH agencies are bound by EBP, evidence-based practices, which are time-limited and short-term, 6-12 weeks. I would be wary of a therapist who seems like they are dragging out your treatment. The goal is progress, not perfection. When your therapist is sure that you told them things you never did, and hold those things against you. Had a psychiatrist like that once. Glad I got a new one. The things she held against me made me look like I was actually crazy. I'd like to take this time to remind everyone that it's important to find a therapist with whom you can click. If their personality is a clash with yours or their modality doesn't work for you, it's fine to find someone else. Hell, it's expected. This is kind of my own personal style showing in a way. But I'm of the opinion that if every session the therapist is talking more than the client, there's something very wrong. It's a little normal for them to interrupt you to focus on something you said here and there, or direct you if you lose your way. But if they are yammering on and you can't even talk about what you wanted to, I'd say that's a pretty big red flag for me. That said, I'd still say give it a couple sessions before deciding on that, because the first session can often mean a lot of information gathering. So they have to touch on a lot of things. If they start pushing their religious beliefs on you. If a therapist doesn't give you an informed consent. If a therapist doesn't thoroughly explain his/her informed consent to make sure you understand. If a therapist doesn't listen to your needs. If a therapist says they are a therapist, CBT, DBT, psychoanalytic, etc., and they don't listen to your individual needs. If a therapist reroutes all your problems back to some aspect of your life. For example, if a therapist tries to make every problem in your life about your sexuality even when they are unrelated. Overall, if it feels like you aren't being heard and understood, red flag. More so, if it feels like the therapist isn't trying to understand your point of view. If they keep validating that it's okay you feel the way you do, but offer no alternative way of thinking. If they disclose more about themselves than you do, when used appropriately, it is usually a way to connect with a client. If every other sentence is I've found in my life that, they aren't using therapeutic skills. They're just going off of their subjective experience to life. For those reading all of these and wondering if their therapist is terrible because they have one of these traits, just remember if you feel your therapist is helping and you can point to moments where they have positively changed your mindset on a memory situation schema, etc., then they are good for you. Someone else said it well in here. A therapist match is like a dating match. A good match for you is full of red flags for someone else. A therapist won't be perfect either. They should stick to what they were trained on and not try to dive into untrained territory because they feel you need it. The difference is a good one will explain that to you, and it's up to you to decide if their technique is compatible or not. They are a teacher at the end of the day. They should help you add to your toolbox to become happier with your life. I hope everyone reading this thread finds the tools they need. A few things come to mind right away. 1. Is there any good reason to know about their ex-husband, kids, pets, son-in-law, etc.? I think not. For $100 plus for 45 minutes the focus should be completely on the patient. 2. Should be number 1, are they licensed LMAO and is their office legit? You can check their license number, which should be readily available on their business card, invoice hung up on office wall, ask for it. Does it look like a business office or an isolated deserted building with just you and them? Do you get a creepy vibe? 3. Do you feel better or worse after you walk out? Do they approach problems with assurances or just make you feel bad about yourself? Do you go home with new tactics or strengthened tactics to deal with your life? 4. Are they building you up to function well on your own? Do they measure success by you not always needing sessions? Are they happy for you when you are stable enough to dial back frequency of sessions? 5. Are you practicing techniques in your sessions that can be used when you are on your own? Are they holding you hostage as a place to spill your guts? Or are they teaching you to practice their methods across multiple parts of your life? Therapist here. They should never make judgments about people in your life, especially yourself. It's pretty basic that you can't form an opinion on someone based on your patient's description. Doesn't mean they never say anything about the relationship, but they should seek a lot of information and only talk about people in relation to you. Not keeping professional boundaries, like sharing personal information about themselves, giving you direct advice about a serious decision, like a breakup, expressing their personal opinion strongly, any sign of judging your decisions, opinions or feelings. Therapist here. The big 3 are as follows. Talking about themselves in a way that is too detailed or detracts the attention and focus from you. Advice giving. We are not here to tell you what to do. Not referring you on when an issue is out of their competency. For example, attempting to treat LGBTQ issues without training or skills with that particular population. Does it seem like he or she is telling you what you want to hear? Chances are, you went to a therapist in the first place because something isn't going well in your life. If all they are doing is validating your way of thinking without challenging you and offering to teach strategies to help you going forward, chances are therapy from that person isn't going to be any more useful than chatting with your bartender at your favorite pub. Also, therapists too often forget that people lie. If they take patients' self-report as gospel, important factors may be missed. As a fairly young therapist, it is not unusual that my patients are unsure about me being competent enough at my age. They will think you lack the experience of an older therapist that has been longer in the job and went through more life events themselves. I think it's important for me to listen to those concerns and, if it is their wish, give them my view on this matter. Usually that's all it takes for them to get more confident in my skills. I think a massive red flag is a therapist that is getting very defensive when confronted with concerns or critique. It's usually a big sign of trust if a patient opens up about those things and a chance not to be missed. If they talk a lot about other people, especially if they sound like other patients. The worst things a therapist can do. 1. Give you solutions and telling you exactly what to do instead of helping you find them. 2. Starting with a faith approach treatment. I have known a therapist whose immediate approach is to evangelize the patient, disregarding their beliefs. A therapist is not a pastor. One thing is discussing your beliefs, another one is the therapist imposing them. 3. A therapist needs to be a blank space where the patient starts putting their ideas. Among the things that means is that should not be judgmental and should not involve or establish personal feelings towards you. Is not there to be your friend or partner. In the pre-internet era, I referred a woman with an eating disorder to a therapist who claimed to be competent in that area. She was obese and ate a Big Mac while interviewing the woman, who not surprisingly did not return. I also spoke to a woman who, while divulging the fact that her brother had committed suicide, was interrupted by her psychiatrist while he took a phone call. Therapists who don't set clear boundaries. Boundaries are very important. As someone who really needs to see one to get to the bottom of some personal go to say it is unreasonably hard to find one, even in a major city like the one I'm in. Navigating that, across what my insurance will cover, and I just end up pushing it on down the road. Really discouraging. I had a client tell me about how she had a therapist who didn't believe that the client's parents were physically abusing her when she was a teenager, about 4 years ago. And the therapist wanted to talk to her parents to check to make sure the client was telling the truth. You call the child abuse hotline immediately. You don't talk to the abusers to verify the victim's story. This therapist never called the hotline and told the client that she didn't believe her. and my client was abused for 2 more years because of it. If a therapist tells you that she doesn't believe your story, get a new therapist. It's not our job to dictate what is true and what isn't. It's our job to help you process through all of it. Edit. Thought I was on mobile and used for italics more than less than. I went to see a university therapist once. I was finding it hard to stay motivated. I dropped out of school because I have this devil on my shoulder that tells me I can't succeed and to give up even though I'm very bright. After the 3rd or 4th session she just says, "Well, if you're not willing then I can't help you." Ducking destroyed me. I felt like a lost cause, so I ended up skipping exams and just dropping out of uni. I had depression at the time too. Fast forward 6 years and my girlfriend saw her at the same uni. She basically just told my girl to get over herself. My girlfriend was like, "You can't just say that." She got her phone and started recording and said, "You wanna say that again?" The psychologist was so sure she was doing the right course of action she repeated it for the recording. My girlfriend took it to head administration and she not only got her fired, she got her psychologist license revoked for malpractice. Therapist in training here. I think everyone has covered most of the big ones. Here is a bullet point list of what I think others covered. If they don't provide informed consent. If they don't review the rules of confidentiality every so often. If they strictly provide advice rather than encourage you to think of options. If they don't gently challenge your thoughts and assumptions. If they try to push a religious agenda. Checking their phone and email while with you. Here's what I would add. If they ever at any point make a sexual pass or flirt with you. If they try to friend you on Facebook or any other social media. If they disclose identifying details about other clients to you. If they shame you for any decision or otherwise deliberately make you feel bad. In group, couples, family, etc. counseling, they seem to pick one side over the other. Choose a team. If they disclose traumas that happened to them during the session and somehow make the conversation about themselves rather than about you. Hope this helps. Edit. Dumb mobile formatting. Edit 2. Thank you so much for the gold. I had a therapist who refused to discuss some of my issues. For no reason that I could discern. I just talk and there would be absolutely no response until I changed topics. I got a lot sicker during that time. I tried taking to a therapist about abuse I'd suffered as a child. She shut me down and said we should be talking about positive things and looking forward to my future. She did what every toxic adult had done in my life. Tell me to avoid my trauma. What a poisonous therapist and experience. My old therapist would leave the ringer on her cell phone and would check it during sessions. She would also sometimes talk about how hard it was to come to work some days. She laughed a lot. She would laugh at certain things I struggled with, like porn triggering me, and would brush off those problems with things like it'll change when you get older or fake it till you make it. I suffer from emotional dysregulations and am highly impulsive, so when I get mad I do a lot of ducked up it. When I would share stories about mean things I did while angry and impulsive, she would laugh and say things like, "I can't believe you did that and that's crazy." Eventually she started shortening our sessions from an hour to 45 minutes and sometimes even to 30 minutes. Worst thing was that I requested to see her once every 2 weeks, but she always scheduled me in for once a month. Later on I found out that was highly unethical due to my self-harm and suicidal tendencies, and she should have actually been seeing me once a week instead. When they're invalidating of your emotions. I'm in a Masters of Counseling program right now, and one of our professors says his 2 rules are this: if the therapist is not in therapy themselves, run, and if the therapist is not in some kind of consultation with other therapists to get other perspectives their clients, run. Finally I got something to say. Not a doc, but I was a patient of one. I had been seeing him for almost a year and had made significant progress. I witnessed a tragedy. Came in for my 3-month check-in, and he starts talking about his wife and how she never initiates intimacy with him. I had no idea how to respond. I was still a little fragile but became immediately uncomfortable. The appointment took a weird turn. I couldn't get out of there fast enough. I tell my husband about and how it was really weird overall. Even the receptionist seemed extra anxious. Know it 2 weeks later. His mugshot is on the local evening news. He was arrested for breaking doctor code and having an intimate relationship with a patient. The patient got overwhelmed and asked to break it off. He became obsessed with her. She filed for a protection order and he broke it. His poor wife and kids were humiliated. He went to jail. Ex-family moves to Houston, I think. I couldn't find a doc that would see me in less than 4 months, so I canned to go cold turkey off depression meds. It was hard. I felt horrible for 3 weeks. But I made it through withdrawals and now I'll live a healthy life. Thanks fam. A story to answer your question. A few years ago, I was feeling really low about how I looked. Discussing how I felt I didn't fit the standard definition of attractiveness and that sometimes made me feel self-conscious. At the time, I was talking to a life coach instead of a therapist. Friend of the family. The response to me was to just change what I don't like about myself and recommended weight loss programs, eyebrow treatments, skincare salons, places to straighten my hair, etc. I left our session hating myself more than I walked in. If a therapist ever did this now, I would leave on the spot. I never said I wanted to change. I wanted help feeling okay with how I was, and this lady didn't pick up on it. Her suggestions to me said, "Oh yeah, I agree, you're super ugly, here's how you fix it." If a therapist doesn't welcome confrontation or check in with you about how the process is going, they need to make sure you're getting something out of therapy so they can be effective. If they're not willing to change their approach to fit your needs, then you'll want to find someone who can. I'm not a therapist, but a red flag that I should have found when I saw one of my first therapists is that if they get political, you should go immediately. Me and my therapist would constantly argue over political beliefs, which worsened my anxiety and depression. In retrospect, I would have left long ago. Countertransference. When a therapist projects certain feelings or assumptions onto a client. My ex-partner and I had started couples counseling. At some point, I revealed my negative opinions about cops and the entire law enforcement system, grounded on personal experience. She told me her husband was a retired cop and argued with me. She had a contentious attitude in the next session. Unprofessional nitwit. Using just before making suggestions or assessments. When you tell someone just try to stay positive or just try not to let it get to you, you're basically saying your problems are trivial, and you wouldn't have them if you just tried harder. It's a surefire way to create a rift and make the patient feel itty. If someone's struggling, be careful how you speak with them. Nobody wants to infer that the struggle they're in is a result of them being lazy or weak. I've had a few really good therapists and a few really weird off ones. 2 in particular stand out. One asked me where to put myself on the Enneagram, and when I explained that I've adapted throughout my life and can kind of rotate throughout them, she told me that's not possible. When I did the tests and it defined me equally with some, she said I must have lied and continued the therapy but locked me into one type, and if my response wasn't typical of that one personality, then I wasn't being true to myself. I'm not against enneagrams, but she treated it like a horoscope. I literally wasn't a person to her, just a type. The second one told me I needed more salt lamps at home and that the plants in his office were strategically placed to absorb my negative energy. No dude, I don't need salt lamps. I had just agreed to terminate life support on my brother. I needed to grieve. Oh, and there was the one constantly spending the whole session talking about Trump. Good lord, why are there so many quack therapists out there? Why is there not better oversight for this field? This is absolute lunacy. I'm training to be a therapist and there's 4 big no-nos. 1. Do not give advice. Unless the person specifically asks for practical help, then advice is useless. 2. Do not bring your own stuff unless it will be useful to the client. 3. Do not ever break the boundaries or allow a client to do so without calling them out. 4. Do not try to save clients. You can light the path, but they have to do the work. When they start to say stuff like she, he, they is looking for attention, they don't help at all. I mean, like a lot of attention seekers. Some can be, but telling that to someone WHO needs help will make them worse. Another us when they have the smart intention to purposely ignore something important that is said, or blame their problems on the patient. I'll probably get buried in the comments, but oh well. I've been working as an LMSW for 2 years in a clinic. Here are some red flags. 1. When you act out your strong emotions. Therapist gets triggered and gets defensive, angry, or in general projects their emotions onto you, as opposed to being a holding space to allow you to process them and then work through them. 2. You feel terrible after many sessions with the therapist, and especially after talking about it, it doesn't get anywhere. 3. Therapist gives a lot of advice. Therapists aren't really supposed to give advice. They can make suggestions that you think of trying together. But if therapist is constantly pushing their values or opinions on you, something is wrong. 4. Seems to have a hidden agenda. What you want to work on is your relationship, but the therapist keeps bringing up anxiety. It could be that the therapist suspects that anxiety is the core issue. That's too many steps ahead and she should meet you where you are and slowly maybe get to the core but not rush you. I cancelled a therapist once because she kept calling me by the wrong name, after correcting her every time, and forgetting our meeting time 4 times in a row. If you talk to them about something very serious and they don't take it seriously. I talked to a potential therapist about feeling suicidal and they weren't concerned. A real therapist should take this kind of things and make sure you are safe, and report it if you are in any kind of serious danger. Pay attention to their body language. It should somewhat be mirroring your own, not to the extent where they downright copying you, but it should display the same general affect or feeling that you are expressing. If you are disclosing something incredibly difficult and personal to you, you want that therapist to be leaning in, really showing that they are listening. If they are kicked back in their chair, they may be lacking basic empathy skills. We are usually taught things like this, but honestly, it comes natural to most. However, this comes down to personal taste. You may find you prefer the more cinematic representation of therapy you see in movies, TV shows,